Welcome to Cinnabar Acupuncture Clinic and Spa. We are the first traditional Asian medical spa in San Diego, which means that we offer a more professional clinical treatment.
Welcome everyone to the Inspirational Businesswoman Show. This is Virginia Parsons, your Hangout mentor and the host. I'm excited to have you here today as always because it is my passion and my purpose to provide you, the viewer, with a goldmine of entrepreneurial tips, strategies, and advice to grow your business from inspirational businesswomen in the know. So thanks for being here with us today. We've got a great show lined up for you. When you get here, let us know who you are, where you're hanging out from. Hope your weather is better than it is on the East Coast. We've got beautiful weather out here on the West Coast, and we're sending lots of warmth your way if you're out there struggling with the cold. Now, today's show is sponsored by hangout-marketing.com, where you can receive a free Hangout marketing assessment that's going to measure your skill sets and your knowledge base in learning how to pick up Hangouts on air and use this tool to brand, market, and grow your own business. So if you'd like to take advantage of that assessment, it will only take a couple minutes. All you have to do is text the word SUCCESS, SUCCESS, to 307-269-2040. And when you do that, you'll get back some wonderful information that'll get you started on your path to learning how to use and brand yourself with Hangouts on air. And it'll only take a couple minutes, and you might even qualify for a free strategy session with me. So go ahead and take advantage of that, won't you? Now, today, I'm very pleased and excited to bring to you a woman that I've gotten to know recently who I think is really doing some wonderful things in the area of ancient wisdom for health and beauty, and that's none other than Dr. Lia Andrews. Now, Dr. Andrews is a doctor of Oriental medicine and acupuncture, a licensed acupuncturist, and she's also the author of 7 Times a Woman. She's going to be talking to us about what that means in a few minutes. She is also a co-owner and co-founder of Cinnabar Acupuncture and Spa, located in San Diego. Now today what we're going to learn about is these 7 cycles that women have and how we can go about healing hormonal balances that may happen during these cycles. Now, this show is not for women only. You guys, we're glad to have you here. And you also can benefit by knowing about these cycles that women have and the imbalances that can occur. So pay attention. But not only to that, we're going to be talking about Taoist sexual cultivation. And that's going to talk about how to use sex to increase health and longevity, something that the ancients have done for decades and decades. Finally, Leah's going to give us a Qigong demonstration that we can use to heal, balance, and energize our systems in a moment's notice. So I'm very happy to welcome to the show Dr. Lia Andrews. Come on in and say hi to our audience, Dr. Leah.
Hi, Virginia, and hi, everyone. Thank you so much for having me here. It's such an honor. I should say that Virginia was the one, I took her course on how to do a Google Hangout because I'm not very tech savvy, and she made it not as scary as I thought it was going to be. So thank you so much. It's such an honor to be on your show today.
Well, thank you, Dr. Leah, and also it's a thrill to have you here, and you're so easy to work with. I think you must have been well trained.
Okay.
It always makes a difference when someone has had experience with Hangouts and Air as far as, you know, the interview going smoothly. Well, Dr. Leah, would you share with everyone, because I think your background is fascinating, and how you came to embrace this ancient Oriental medicine?
Absolutely. I did not come from an alternative medicine background. I was raised in a family of doctors and engineers, and we did not believe in any of this woo-woo crazy stuff, especially over 20 years ago when I had my own health issues. It started at puberty for me. I started having horrible headaches, all kinds of bizarre hormonal imbalances, and it wasn't until I was 17 that my mom got desperate enough, taking me doctor after doctor, not finding out what was going on, took me to a naturopath. And he did something called muscle testing or applied kinesiology, which now is pretty mainstream, but it was very wacky to me when I first was exposed to it, and found that I had an issue with my pituitary gland. And he sent me to an MD friend of his who did an MRI on me and found that I actually had a tumor on my pituitary gland, which is what was causing everything. The pituitary gland is the master gland. It is going to be the one that's going to send the signals to all of your other endocrine glands and can control so many functions in the body. So, and then also the physical, the mass was impinging on my optic nerve and causing the headaches, the physical headaches as well. So that was what the cause was. The answer for Western medicine at the time, and I think it still is now, is to go in with laser. And the issue with that is that they go in through the nose, and they can injure the actual gland along with the tumor. It's really hard to just get the tumor, and that means that I could be on serious hormones for the rest of my life. So again, my mom didn't want me at 17 to have to face not being able to have children and all these other things, so she took me to an acupuncturist, which was way out of our comfort zone. But that first acupuncture treatment changed my life, because all of a sudden I felt like I was in my body. I could feel energy moving, something I'd never felt before in my life. And I felt this deep state of relaxation and presence that I hadn't ever felt. I mean, this was a time before everyone does yoga and meditation and breathing exercises now. When I was 17, that wasn't mainstream, certainly not in North Carolina. So this was a whole new world that opened up to me, and thank God it did.
Well, what fascinates me is that you struggled with this problem for obviously the first 17 years of your life, or close to, you said, since you were very young, and that it wasn't discovered. You had, so what kind of symptoms did you have? You had headaches and that sort of thing?
I had headaches, I had joint pain, I had, my menstruations were just completely wacky. So there's obviously something really wrong with my body. I had acne issues that were really extreme, just kind of all over them, and it would shift too. It wasn't something that was consistent. All of a sudden I would develop a new issue, and then that would shift again. It was very bizarre.
Well, so as a result, you, in all that time, the traditional medicine had not even discovered that you had had that tumor until you were 17 then.
Yes, and I think what I really faced, and one thing that I can have a lot of compassion with my patients about, is not that Western medicine is wrong. Like, my grandfather was an excellent doctor because he actually spent time with his patients. But the way that medicine is practiced now, Western medicine is practiced now, is that you've got, a few minutes face-to-face with your doctor. He is being heavily pushed to push certain medications because the product reps have brought those in for him and are heavily pushing that. He is very restricted by what the insurance companies will allow and not allow him to do. So it's very hard. I feel a lot of compassion for physicians now that I've been on the other side and seen kind of how the insurance companies work. It's very hard in our system of medicine, if you don't have a cash-based clientele, to practice medicine the way it should be, where you're actually paying attention and speaking enough to your patient to know what's going on.
Oh, I totally understand that, and I think that most anyone who's viewing today would probably second that. It's very hard to have any time with a traditional doctor, and it's not their fault. It's because they really do want to be healers. It's just the circumstances of the system that makes it very difficult to get the time spent. Mm-hmm. So you went to acupuncture, and your very first session you felt relief.
Yes.
And from there, how did you determine, or how was the tumor on the pituitary gland treated?
Well, so in Chinese medicine, we don't treat by the Western diagnosis. We take that into account, but there's a whole system of diagnostics that we use. So he didn't treat me for my pituitary gland. He was treating the symptoms that were coming up. So in 3 months, he had fixed my periods. He had fixed my headaches maybe 5 months in. And then a year later, I did another MRI, and the tumor was not there. It was gone. There was no tumor. So it was a gradual process where I started feeling better and better. My symptoms kind of started going away. And then after about 2 months of being completely symptom-free, I wanted to see what the status was and have a diagnostic tool confirm that I was okay. And I did. It was about a year later. So I did actually see him consistently for almost a year's time. And for something with a deep endocrine issue like this, it does take time. It's not going to be a quick fix, like a back pain might be or something.
Well, and also because it sounds like you probably were having problems with it for a long time. You can't really expect an overnight solution, especially you didn't go in for surgery, which I can appreciate why that would have been a challenge. So you then decided, or your mother decided, I think she's probably the first one that took the route then into Oriental medicine. Is that correct?
Yes, when she saw me going through what I went through, she started to read books on it. And then she started to say, oh, am I too old? Because she has an MBA and she was doing business. This was completely different than her world. And she felt like she was too old. She was in her late 40s at the time where she decided to go to acupuncture school. So it was like, am I too old to start this completely new career? But our acupuncturist encouraged her. He said a lot of people start alternative medicine as their second career, at least that they did at that time, because it was a very new field. So
how fascinating! So then you from there went on to get advanced degrees, or both of you have, I guess.
Yes.
And then you started to specialize in women's hormonal imbalances. What a surprise!
Yes, absolutely.
So let's talk about that a little bit. What are some of the biggest imbalances that you see in women? And let's start with that.
Sure. There's actually 3 key times in women's life where it's very important to fix hormonal imbalances. That's going to be your menstruation. It's going to be postpartum, how you are during pregnancy and after birth, and then the menopausal transition. Those are really important times when our bodies are in transition. Symptoms will flare up if we're not completely in balance. So it's a great time. It's actually a blessing. Everyone gets upset when they have symptoms, but it's actually a blessing to have those symptoms come up, because it's like, oh, okay, there's a problem here. We need to fix it, and that's going to shift things so that you don't have to have a bigger wake-up call later. For example, if you have your menstruation is irregular, or if you have menstrual cramps, once you see that that's the case, then you fix it on that level. You don't have to wait until years later you have infertility problems, or years later you have a tumor or a mass show up. You can fix it when it's still a small symptom. And it's the same thing with menopause. As you're going through menopause, if you fix hot flashes when you're going through that time, you don't have to wait until 20 years later when you have a more severe health issue show up.
Well, that makes absolute sense, because again, think about your own situation where it took about a year really to have the symptoms totally cleared up.
Yes.
But if someone comes with symptoms such as the cramping as one thing, and most people would think that cramping with menstruation is normal. Are you saying that it's not normal?
It's so there is what's kind of I call pathologically normal, which is what a lot of us accept as normal. In Chinese medicine, we would say that you always want to reach a higher level of health. So any small thing, like even that you always feel, it's really hard for you to wake up in the morning. Chinese medicine would look at that and say, okay, you probably have too much phlegm. and not enough yang energy, that you're not waking up when yang energy is strong. And it's much better to look at those little details where it's not a huge problem yet. It's not a, for most, well, some women have debilitating cramps, but a lot of women have minor cramps and they're like, oh, I'll take a Midol. It's not that big of a deal. I can ignore it. But if you paid attention to those cramps, the cramps mean that your body's not easily and effortlessly discharging the vaginal, the uterine lining. Mm-hmm. That's what that means. There's some kind of blockage going on there. Probably a minor blockage, but if you deal with that blockage on that level when it's still small, you're going to prevent having a bigger blockage later, which can cause things like masses and fertility issues and things like that later down the road. So yes, I would.
No, go ahead. So what would you do? I mean, I know you can't go through a full treatment protocol, but what are some of the? No, let's talk about what you might do, and then what you might recommend that your patients do.
Sure.
Because it's also about their care. They're caring for themselves as well.
Absolutely. There is so much that we can do on ourselves, and this is what I'm really passionate about, is on patient education. Because we as acupuncturists, as healers, any kind of healer, there's a lot that we can do. But if we practice, as people practice good self-care, we can avoid a lot of these issues. So one of the things that we usually don't do as women, we're taught to ignore our periods instead of taking good care of ourselves. You should rest more during your menstruation. You should avoid cold. You should not be swimming in cold water, for example, during your menstruation, because that's going to impede circulation. You should be eating warming foods, more protein-rich foods during your menstruation to recover blood loss, things like that. Those are just little tips that can keep a healthy woman healthy. It may not be enough to fix a more serious imbalance, but it'll help keep you healthy. After giving birth, for example, very important to do your Kegel exercises to strengthen your vaginal muscles and the pelvic floor muscles to prevent incontinence issues later on in life. That's a huge problem in our society right now. So many women suffer from incontinence that we have all these ads for diapers, and it's become normal. I like that you're taking away the stigma from women who suffer from this, but there's a lot of this that can be prevented in the first place if we practice good postpartum care, good menopausal care. A lot of women wouldn't be facing this in their later years. And it's a really sad thing to face and preventable in so many cases.
Well, I was mentioning to you that my mom had that issue when she was older, and yeah. It's very difficult, and it's hard from a dignity standpoint.
Yes.
So, do you have a recommended protocol in addition to, obviously during the menstrual cycle, allowing things to flow, but what about as you get older? What kind of protocols do you have or suggest for women who are menopausal age and up?
Well, there's a lot of things that we do. I recommend, and I have in my books, I talk a lot about how to do vaginal exercises and meditations to do that help. And this ties into Taoist sexual cultivation. In Chinese medicine, this is not, anything really provocative or out there. What we're really talking about is sexuality is a part of our health, just like our nutrition is. That's the way Chinese medicine looks at it. It's not, it doesn't look at it as this kind of, thing that you put to the side. Because what happens is our sexuality, our sexual functioning is directly tied with our health on many levels. So, for example, if our sex hormones are alive and pumping normally, that's going to keep us young. Because when we have sexual energy, when we have a healthy sex life, it's going to trigger us to produce sex hormones because our body thinks that we can maybe have a baby out of this. And that's going to keep us young. So the ancient Taoists found that by finding ways through meditation and through certain exercises, keeping the sexual energy vital, that also kept the hormones at their peak and kept us young longer. The other way that it ties in is a lot of the sexual practices are about strengthening the pelvic floor, and that is key to avoiding so many issues as we get older. Incontinence and prolapse are a huge problem as we advance in age, and the only thing that is really holding everything up down there is just this webbing of muscles and connective tissue. There's no bone structure down there. So if we don't keep things lifted, then a lot of bad things can happen.
Well, and this has got to be relevant to men and women
Yes,
both, I would
absolutely.
assume. So what kind of at-home practices can you recommend so that we can stay vital and healthy sexually?
Sure, and I just want to step back 1 second and talk about my book, 7 Times a Woman. The reason why it's called that is women have, every 7 years, we have a different hormonal cycle. We change our hormones. And at 7 times 7, that's when menopause tends to happen, and that's when it becomes really, really important to be doing these practices I'm going to talk about in a minute. But at about age 35 is when women should start practicing anti-aging practices. For men, it's about age 40 because men are on an 8-year cycle. So they take a little bit longer to mature, as most of us know, and they have a little bit more time before things really start to hit the fan. At about 40 is when things start to shift for them. So 35 for women, 40 for men is when they should really start doing the sexual practices, the meditation, nutrition, a lot of the rejuvenation exercises. And I'm going to show one of them right now that's called Perineum breathing. It would be considered part of sexual cultivation, but as you'll see, it's not really, I guess, sexual in the Western sense. First, I want to kind of set it up that we are going to be talking about the perineum. The perineum is the space between the genitals and the anus, and energetically, that's a very important point during meditation. You always want to be lifting that area up to keep the energy circulating in the body. And physiologically, what that's doing is over time, you're strengthening those muscles and training your body to keep that area lifted up and not letting it sag and prolapse down. So there's a real physiological reasoning behind it. When we do breathing, we want to do what's called abdominal breathing. Instead of breathing, shallow breathing from our chest, which is what we usually do because we're all tense like this, you want to put your hands on your lower abdomen, just below your belly button. And as you inhale, you want to feel your abdomen expanding, and then as you exhale, lifting your hands up, and then as you exhale, you want to feel your abdomen deflating. So as you inhale, your tummy is going to lift your hands up, and then as you exhale, it's going to bring your hands back down. That's just going to be your normal breathing. It's like your full body is involved in the breathing process.
Well, I would say that that's probably not our normal breathing, but that should be our normal breathing.
That should be normal breathing, absolutely. If you just did that every day, most of us are all like, we don't realize we're all like this. If you just start doing that, all of a sudden you're going to feel like everything's flowing. You're going to feel the energy moving in your body. You'll feel less stressed out. Just that simple, just remembering to breathe appropriately can change your life. It's amazing how just that little thing right there can help so much. But with the perineum breathing, we're going to add to that. So you're going to sit on the edge of your chair so that your sit bones are right on the edge of your chair. Back straight, and you're going to inhale. You're going to tighten your PC muscles, your pelvic floor muscles, your Kegel muscles. And by the way, these are the muscles that you squeeze if you were urinating and wanted to stop. That's the same muscle group that you would be activating. So you're going to squeeze those muscles as you inhale, and you're going to imagine lifting the perineum up. You're going to imagine a line going up from your perineum to the top of your head, and as you inhale, tighten the perineum. Imagine that energy coming up to the top of your head and holding that energy on the top of your head. And then exhale, letting everything go.
Now, when you let everything go, are you relaxing the perineal muscles that time as well?
Relaxing everything.
You want to practice. I just want to clarify that. You are inhaling, pulling the perineal muscles up as your abdomen expands, and you're imagining it going to the tip of your head.
Yes.
And energetically, and then as you exhale, relaxing everything and letting the energy flow back down to the perineal area.
Precisely.
I got it. And let's pause a moment. Are the rest of you doing this with us? We're going to do it a couple more times. Come along, join in the fun. This is for your sexual health and vitality.
And by the way, this practice is for men and women. This is not gender specific. So men and women should be practicing sexual cultivation exercises to keep themselves young. It's for everybody. So this is not a women's only show. I know that Virginia has some wonderful male viewers out there too. So I want you to feel welcome. So
all right, here we go. All together now. Go ahead, Leah.
So we're going to tighten the pelvic floor muscles as we inhale, imagining the energy coming up, the center line of the body, up to the top of the head, holding it there for a second. And then exhale, letting everything relax. Whenever you're training muscles, you want to be able to have full range of tensing and fully relaxing. That is the full control of a muscle. This is true as if you were lifting weights, and this is true of your pelvic floor. So that's why it's important to relax everything too. You don't want to be holding constant tension anywhere in your body. You want to consciously tense and relax. So we're going to do it again. Okay. Tensing the pelvic floor muscles. Deep breath in. Imagining the energy coming up the center line of the body to the top of the head. Holding there for a second. And then exhale, relax everything. We're going to do it one more time. We're going to tense the pelvic floor muscles. Inhaling. Bringing the energy up the center line of the body. Up to the top of the head. And then exhale, letting everything go. If you were going to practice this for real, you would want to do this 24 times, ideally twice a day. So first thing in the morning, maybe last thing before you go to bed at night. And that alone is going to start to strengthen the pelvic floor. It's going to start making that connection. And it's also going to start circulating energy through the body, because through that visualization, you can really feel like you're bringing that sexual energy up to your brain. You're bringing it back into your body. You're not letting it go. So the Taoists were really clear about moderation in all things. They did not believe in being shutting down sexuality, nor in having too much sex. It was about bringing it into a balanced state and not wasting sexual energy on, having sex all the time. Sometimes you bring it into your body and let it circulate and have it have another use, because that's energy. Sexual energy is just energy. And you can use that energy to help your brain function better, to help energy flow better in your body, to help you, through breathing exercises, help your body relax more, so that it's not just this wasted energy that's quickly dissipated. So that's really the thinking behind it.
Well, I find it fascinating that you're suggesting 24 times, 2 times a day, which wouldn't take very long to do. What I'm noticing, though, is that, and I guess maybe I'm out of shape down there. I'm not going to go any further than that. Not too much information. But that it's something that I can feel as I'm pulling up, but it wants to release sooner than you're suggesting. So in the beginning, I'm assuming like any muscle, it's weak if you haven't worked it much. Absolutely. And that ability to hold and that retain that tension in the perineal area will increase in its own vigor.
Absolutely. And I think a lot of us, when we first start doing this, it's like we even have to use our imagination to pretend to tighten those muscles because we don't know where we are. We feel a disconnect with it. And that's like with if you started an exercise program, you can't isolate your deltoid or your hamstring muscles. When you first start, you barely can get the whole limb to move the way you want it to.
Right.
And then over time, you start to be able to isolate and really fine control things. I mean, when we first start to write or eat with a spoon, you see children, it's very, very awkward when you're trying to make things work the way you're supposed to. And it's frustrating. So don't get frustrated. Don't give up on yourself. Don't be hard on yourself, because it is really hard to get muscles that you don't use to start firing the way they're supposed to.
Well, but the benefits are so valuable when I consider how my mom suffered with this challenge. I certainly think that it's something that we have within our control. And we were talking about, there's a whole new adult diaper market out there that is, they're advertising that you never even heard about adult diapers being advertised before, but we've got a whole baby boomer generation coming into the senior age. And the other thing I was saying is that we have advertisements for catheters. Can you talk to that a little bit?
Well, that's there's a few things that can be going on with that. I mean, there's the prolapse aspect of it. There is a lack of muscle control. There's a lot of things that, there's people that need catheters that these exercises are not going to, prevent that from happening, because there are cases medically where people need those things. But I think the fact that there's just such an epidemic of people not having control over their urination, that is completely avoidable If we do nothing, a lot of what we call aging is basically that we are not actively keeping ourselves up. So when we're young, things are firing and in a certain level, you don't have to necessarily worry about doing Kegel exercises and strengthening the pelvic floor muscles. But as we get older, if you do not exercise your muscles, and this is anywhere in your body, they will start to atrophy and not function. If you do not exercise, if you do not move your joints, that's another huge thing in any kind of longevity medicine. Yoga, Ayurveda does the same thing. You have to keep your joints moving so that they're properly functioning and limber. You have to keep your muscles and tendons elastic by stretching them on a regular basis. If you don't use it, you lose it. So the same thing happens with our pelvic floor. If you do not exercise and engage those muscles on a regular basis, once you get beyond a certain age, they will start to waste away and not function. And then over time, you will lose that ability to tighten your pelvic floor when you need to. Doesn't mean you can't get it back, but it's going to be harder when you get older to do it. So it's much better to do it when you're in middle age time. You definitely want to start doing that. If you have a baby through vaginal delivery, you want to do it after then, no matter what your age is, to prevent this from happening.
Well, I think that this is very valuable information, both for men and women. I wanted to point out, let me just pop up and tell you what Neil Brown has to say when he was talking about the exercise you were just teaching. I think it's good for prostate health, too, which is what you were mentioning, wasn't it?
Well, and another thing I want a little tip for prostate health that's really, really helpful to avoid inflammation. Men, they say that men, if they live long enough, will all get prostate inflammation and cancer eventually. That's what they say. So it's a huge issue for men as they get older. Goji berries, you can get it at any health food store. A handful of goji berries and a handful of pumpkin seeds every day will amazingly get rid of the frequent urination symptom of prostatitis, of prostate inflammation. So that is
so easy.
Yes, and it tastes good. You put it in your cereal, you put it in your smoothie. It's an easy medicine. A lot of our herbs do not taste very good. This is actually a nice tasting remedy. So.
Now, are you recommending goji berries and pumpkin seeds just for men or for both men and women?
They're both for men and women. So goji berries help to strengthen what we call the kidney energy of the body. And the prostate and the sexual organs are connected with the kidney organ system in Chinese terms. The goji berries are an anti-aging herb. They're anti-inflammatory. So they're good for longevity and rejuvenation for men and women. But I've noticed they have a very specific function with helping with frequent urination due to prostate inflammation. Pumpkin seeds are specifically to reduce the inflammation.
Wonderful. I put pumpkin seeds in my yogurt. I have a breakfast of Greek yogurt, usually topped with fresh raspberries and pumpkin seeds. I love that for breakfast. Had it this morning.
Absolutely, yes.
Maybe I better get some goji berries too to mix it with the raspberries. Well, this has been great. I mean, I could talk to you for a couple hours, and I really appreciate your being here. And I want to say hi to our audience, and in addition to Neil, I want to say hi to Molly Youngblood Geiger and Doriana Peterson, Mary Fletcher. Thank you all for being here. There's a lot more, but you're not making comments. Oh, there's Sven saying hi to Sven, hanging out from Hanover, Germany. Welcome, Sven. We are happy to have you here. You just got some great information for men as well from Dr. Leah, and I'm just so pleased. Now, we're going to be saying goodbye in a moment. I'm going to post the link so that you can come into the after show, because maybe you have a question for Dr. Leah that you'd like to ask in there, or just come in and say hi. We'd love to have that. This is a great way for me to get to know my audience on a personal level, and I love doing that. And so I want to encourage you, because we're going off the air in a moment, and you won't have to worry about showing up on air to still get some hangout experience in what we call the after show. So I'm going to go ahead and post that now, and as I do that, Dr. Leah, do you have any last words or comments or good ideas or strategies that our viewers can take home with them today to feel empowered and they're most healthy and vital?
Absolutely. Well, I just wanted to say generally that we have a lot more power over our health than we realize. Our health is largely in our own hands in the decisions that we make every day in our lives. And it's really about educating ourselves on what those decisions should be, what makes us healthier on a daily basis. I would like to offer my book 7 Times a Woman for 50% off today and tomorrow for the audience here. I'm going to have a link posted in the comments section after the show. And I just encourage everyone to learn more about your body and take the time to invest in yourself on a daily basis to make yourself healthier, because when you can have all the money in the world, if you don't have your health, you don't have anything. It really is our most important resource. Thank you so much.
Brilliantly said, and I know that you live and breathe and sleep that yourself. Having had the challenges with your health at a very early age,
Yes.
You probably appreciate it more than anyone who hasn't had health challenges yet. So thank you. And so everyone, you heard her say we're going to be posting this after the show. You'll be able to get a 50% off of Dr. Leah's book for the next 2 days. So you'll see the link here in the comment section after the show. I want to thank you all for being here and being the wonderful supportive audience that you are. I love sharing this information with you. I want you to pick up just one thing. And today I think we got some breathing and some exercises that you can go home and apply in your life right away. So I'm always hoping you pick up one good thing, one good morsel and nugget that you can use in your own life for your ultimate well-being and success. So thank you so much. We're going to say bye for now, and I hope that you join us in the after show. Go ahead, say goodbye, Leah.
Bye. Thank you so much.
Great to be with you. Bye-bye now.